I am at APO in Springfield. Lynn, Stacy are both with me, and Lynn, I'm going to ask you to give the overview again. What is APO all about?
We are a community health center. We started as an HIV/AIDS clinic back in '85, and we have evolved, and we see over 1,400 patients for medical care now. Majority of them do not have HIV. We provide primary care, we provide treatment for Hep C, we provide treatment for HIV, we provide a comprehensive STI and HIV testing program, and we also provide harm reduction.
And plenty of education as well.
Yes.
On all subjects. And of course, yes, you used to be called AIDS Project of the Ozarks. It's APO now because it is encompassing so much more than that one aspect. And I know you're always growing, and there's one, I'm going to talk to Stacy about this, harm reduction program. What is that all about?
So harm reduction is kind of a newer term, but it's been part of APO's work since before APO even incorporated in '85. Harm reduction is the idea of trying to take the risks down on any kind of activity that's inherently risky. Things that we do all the time in our everyday lives. When we're driving, we have seatbelts, we have speed limits, we have airbags in our cars to reduce any injuries that might happen.
Common items of living.
Right.
Yes.
So when we're talking about harm reduction here at APO, we're talking about it in the context of really where our work intersects with public health and substance use. So we're looking at trying to reduce the instances of infectious disease with substance use, and also, of course, trying to reduce overdose out in the community.
Sure. Now, sometimes, of course, you're talking about the rules and laws and things like that. They're all out there, but some people don't follow those rules and laws.
The issue with drug use is it's been a part of our human society for thousands of years.
Yes.
This is not a new phenomenon. We as a society have tried to put up safety rails around drug use by making some things regulated, like alcohol, like cigarettes. We have not regulated some things like caffeine, like sugar. These are all things that alter our brains chemically, and for those of us who cannot function without our morning cup of joe, you know how that can impact you.
And that's our own addiction, too.
Right. But the impacts are real. We have physiological impacts, you have behavioral impacts.
So where do you step in? I'm seeing things in front of you. Where do you step in to help people?
So education, and also, kind of having these conversations, being able to start to help people see where maybe their own bias or their own stigma already exists, to try and bring that down for people, so that when folks do get to the point where they need help, they're not afraid to ask for help. So we have products like these that are available in all of our physical locations. We have 2 here in Springfield, and then we have additional case management offices in outlying areas in Joplin, Waynesville, and West Plains. These are overdose reversal medications. So I have everything from the highest milligram of Narcan, which is a nasal naloxone, to a 3 milligram intranasal naloxone, down to a 0.4 milligram intramuscular naloxone. These are all different options for reducing overdose, which we keep in the buildings as well as in a porch box that's in front of our downtown location, and we have a vending machine here at our Glenstone location.
So they are readily available.
24/7 outside. We have a total of 22 between all of the electronic and all of the porch boxes throughout our 29 county service area.
And these are simple.
These are simple, yeah. This is what the intranasal looks like. So if you've ever used like a nasal spray, like for a cold, it's exactly the same thing. The thing that you just want to be careful of is that you don't practice with this, because it's preloaded with 1 dose of medication. So you would just administer it when needed.
Right.
And these are all free. There is no cost for any of the items in the porch boxes, any of the Narcan that we will give out if the porch box is empty. That is all free. We want to save lives.
And these are just some of the incredible programs run by incredible people right here at APO Community Health Center.